name is Zuniga, and I am the Surgical Technologist Lab Assistant. Today is very exciting because we are starting part 1 out of 4 parts of a step-by-step AST guideline of how to set up a sterile field. AST stands for Association of Surgical Technologists. So I do want to mention before we start that during these 4 parts, there may be videos that we've already created. For example, gowning and gloving. We've already created this video previously, so which we run into this situation, I will communicate to you guys, and you have the option to go back and look at those videos. Otherwise, thank you for joining. I will now go change it to the proper PPE, and we will start. Thank you. Here is my supplies that I'll need. I've already found out what OR room I'll be in, what procedure I'll be doing today. I found out what I need to have in the room. I've come into my OR. I've wiped down my furniture, my OR furniture, which can be your back table, your Mayo stand, your light. And now what I'll be doing is starting the first step, which is opening everything. Now, when I open, it doesn't mean I'm going to touch what's inside. I'm simply going to sterilely open the supplies, and then when I go and perform my surgical hand scrub, I can then gown and glove and touch everything that is inside. So I'm going to go ahead and show you guys that. Let's proceed. So the first thing I'm going to do is open my back table pack, okay? So what I like to do is rearrange. I like to make sure that when I open this, it's not going to hit anything around this pack. So I'm going to move my Mayo stand over. I moved my ring stand. Nothing's really in the way. So what you want to do with anything that's sterile before you open it is check the integrity. So I'm going to look at my pack. They look like this. Okay, this is where you open it. They usually have what the name is. And what I'm going to do is I'm going to look at it. I'm going to examine it to make sure that there's no holes, there's no damages. I don't see any, so I'm going to proceed. I'm also going to check the expiration date. Now, this is not expired. We have 2025, so we're good to go. Now what I'm going to do is open this. You do not need gloves on. I've done a simple hand wash. Now there's a little tab right here. You just pull it and it starts to open. Okay? So when I open this up, I have this bag. You can use it for garbage. You can use it for whatever you'd like. That's completely up to you. Now I take this and I do the same thing. I'm going to check the integrity of this packet. So I'm looking around. I don't see anything. I'm going to proceed. The outside of this is not sterile, okay? There's a little tab right here. What I'm going to do is break it. So simply grab your thumb or your finger and open it up. Now I'm going to center my pack. I'm going to open one end by simply folding it out. I'm going to take whatever supplies may be on top before I proceed. So they have given me gloves, a gown, and a prep pack. So this would go to my circulator typically. I'm going to proceed. I'm going to grab this end. I'm going to open the flap all the way. Okay, now that I know those are open, I'm going to come around. You can rearrange your furniture while you're opening if necessary. So if I think this is too close, I'm just going to pull it a little bit, okay? So I'm going to grab the tips of this drape, of the back table drape. I'm going to grab the ends and I'm going to start by opening. Now at this point, everything inside here is now sterile. I have to use my knowledge and make sure that I do not touch the inside, okay? I'm going to do the same thing on the other side. I'm going to grab both ends, and I'm going to open. Okay? Now this is complete. I'm going to move it by grabbing underneath, not grabbing the drape, but underneath, placing my back table where I want it. At this point, I'm not going to touch this. I'm going to move forward with opening up my basin. Okay, so I have my basin here, and if you see the basin, the outside is not sterile, hence that's the reason I'm touching it, okay, because I am not sterile yet. Now you'll see tape. Typically there's black indications indicating that it has been sterilized. What I'm going to do after I've made sure there's no holes or anything that may have damaged this packet, I'm going to move forward and open it. I'm going to break this tape. And on most of our envelope wrapped sterile items, they're typically all wrapped the same way. You have a flap that's faced toward you, and you're going to find that. So I know this is my first flap that I'm going to open away from me, okay? So we're going to start with this. You want to kind of pull down because you don't want these to come back. You want just a little tug, nothing major. It usually does the job. The next flap will be to the left, to the right. Last but not least, toward me. So now this is all sterile. I do not want to touch the inside of the packet. What I can do is reach underneath, and I'd like to show you guys that. I'm going to reach underneath, and if I need to move it, that's totally fine. I like to bring everything that's sterile close together. So we have a sterile field that is now enclosed, okay? Now I'm going to go over to my Mayo stand. So it came with a gown, which is great. Once again, we have our gown. It's envelope folded. We have this video that we've already created if you'd like to refer to it. It's a gowning and gloving video. So I'm going to properly open up my gown on my Mayo stand. I have my gloves, and of course we double glove, so I'll open up 2 pairs. One should be the bigger size, which is the first pair you put on. The second should be the smaller size. I'm going to properly pop it open. Discarding whatever garbage I may have. Keeping clean during the process is a big part because you don't want to waste any time by having any extra garbage or extra work. You want to stay consistent and work as you go along, okay? Okay, as you see, I've now popped my gloves on and they stay in the sterile field. All of this open is sterile. The bottom is not. I have yet to do my surgical scrub, so I will not touch any of this yet. I can now reach underneath, move my Mayo stand. I'm going to have it right about here. Last but not least, I'm going to come over to my instrument tray. So So my instrument tray has a few indications that it's been sterilized, okay? So the indications I'm looking for, there's going to be these clips on the side that have a indication whether it's a circle or a line, and you want to look for the color black typically. And once I see that those clips have changed, I know then that I can now actually open up my instrument tray. So what I'm going to do is I'm going to break those clips off. I'm going to open up my tray and step away, okay? Now, why do I step away? I step away because just in case there's possibly dust or anything on this instrument tray, the last thing I want is for it to fall inside my sterilized instrument tray. We want to keep the instruments clean. It's all about patient safety, and that is a huge step. So properly opening your instrument tray has to be done. Once again, I open it, I step away. Typically there's going to be filters, right? So I look at the filters, I open them up. I grab them, I put them to a light. I make sure there's no holes or no moisture. It looks fine to me. I'm going to check the other filter as well. Put it up to a light. It looks fine to me. I'm going to put this underneath or set it somewhere safe. Last but not least, there's an indicator on the inside. If you come look with me, you're going to see it in your instrument tray. And what we want to look for is a line that goes all the way across and that says accept. I'm going to show you guys one without reaching into my sterile instrument tray. I have this one here. This isn't a typical one, but it's an example. And what you see is a color that has changed. This is a steam chemical indicator. If this were to remain the color that it originally was, which was a yellow, then I would know that the instrument tray has not been properly sterilized. This has turned colors during the process of sterilization, which tells me that these instruments are safe to use on my patient. Okay? So, for any reason, if we were to open our instrument tray, we look to see if that's in there and it has not turned, what I'm going to do is have this instrument tray removed. Our main responsibility is patient safety. If for any reason any of these supplies have been possibly compromised, or we have a thought that it's possibly not sterile, there's no second guessing. We change it out because patient safety comes first. So if I believe that this tray was not properly sterilized, I'm not going to use it and I'm going to ask for another tray. Okay, and that goes with anything in your field. Now that I have all of my supplies open, as you can see, we have our back table, which is the first thing that we open. I've centered it, I've opened my basin. Now that the basin is open, I'm going to bring it closer. I like my sterile field to stay tight and closed. I have my gown and glove open. I have my instrument tray open. Now I'm going to perform a surgical hand scrub. We've done this video before. If you guys go and look on our previous videos, you'll find it there. I will be right back. I'm going to perform it, and then I'm going to gown and glove, and we can start setting up. Surgically clean. Okay, I've completed my surgical hand scrub. I'm now going to gown and glove. So I'm going to bend over, grab my towel. We want to pat all the way down. Rubbing can promote any dead skin, so patting is the best policy. I kind of twist my arm. Okay. I'm I'm going to toss my towel. If there's a garbage nearby, wonderful. That's typically the goal. Okay? I'm going to step up. Now, reminder, I've scrubbed 2 inches above my elbow, so at this point I don't want to touch myself, which is why I'm doing the dramatic bend. I'm going to grab my gown, okay? I'm going to make sure nothing's around me. I'm going to open it. Again, we also have a gowning and gloving video. At this point, I'd be waiting for my circulator to come and tie me. But we don't wait because they may not be ready right away. We're going to continue to gown and glove, right? Because there's no time to waste in the OR, guys. We have to be efficient and continue our roll. Okay, and again, I'm starting with 7.5. Make sure your gloves are comfortable. You don't want them too tight. Your hands will start to get numb. You don't want them too big. You won't be able to properly have the grasp that you need. I don't want to see a lot of extra glove hanging off of the nail. We want it to fit properly. So experiment if needed. Find that right glove size. It's very important. Properly gown and glove. My circulator has come behind my back. That is not sterile and has tied me up. Now I'm going to discard. So there's 2 ways. You can either have your circulator grab it, or I can simply grab from the inside, do a pinch, step away, and discard. Okay? Got discarded. So now, the first thing that I like to do is to put my Mayo stand cover on my Mayo stand to extend my sterile field. So we're going to look at what we have in here, make sure we have everything we need. It comes with my surgeon's gown, surgeon's gloves, some towels, my Mayo stand cover, some laps to absorb any blood or any fluids, my garbage bag that I like to use for any excess garbage on my field. Comes with some suction tubing, and it comes with my drape that I will drape my patient with. And we will talk about it more. We have our other supplies in our basin. But the first thing I want to do is to extend my sterile field. So with the Mayo stand, you have an indication. There's hands here, and it even says left and right hand. So you're going to put your hand underneath. You're going to make sure everything's away. Okay, I like to make sure there's an opening. I grab my Mayo stand, pull it away a little. I think it's too close to my back table. I'm going to belly up and get close so that this portion does not fall below my sterile field, which is to my mid-chest, to my waist. I'm going to keep pulling the Mayo stand. Okay, it's complete. I'm going to pull it closer to my field because now it's sterile, it's covered. And I'm going to cover it with this sterile towel. What this does is prevent strike through. And we recommend it. We actually require it here at Ultimate Healthcare. We don't want to have any strike through at any point during a surgery. It can, one, it contaminates the field. It can cause infection, which is what we want to avoid. And it can just delay the time in general. We're going to have to now cover up that hole, the strike through, possibly replace the entire Mayo stand cover. So this towel is a protector. Okay? I'm going to tuck in all sides of my Mayo stand. We want it nice and tight. And if you need to use 2 towels, that's totally fine. Sometimes Mayo stands vary in sizes. Some are bigger, some are smaller. So whatever you feel you need to do. Okay, so I would say that that's fairly set up. Everything's tucked in. I'm going to bring it up to my fill. I'm going to towel off my back table. Some back tables do come with towels that are already integrated onto them, so they've been built with the towel inside of them. However, this drape is not. So I'm going to towel off this entire back table. Once again, this helps with any strike through. And you also want to keep in mind, while you're setting up, you want to make sure everything looks organized. We don't want the towels to be sloppy. We want it to look organized and professional. Okay, so now I have created my towels and I have my back table toweled off. Now the next step we do is set up, okay? So in the top right corner, I'm going to have a few different supplies. One of them being the doctor's gown, gloves, and towel. Now when he comes in, he's going to want his towel first, he or she, because they're going to have come from scrubbing in. So I have it in an order that makes sense. I'm not going to have his gloves on the top when that's the last thing he puts on. So I'll have his towel, he comes in, I give him his towel to dry his hands. Then I have his gown, and then I'll glove. We actually have a video of gowning and gloving a doctor as well. Okay, so there's that in this order. I like to put it at the top right. I also like to put the drape for the patient. I actually typically put it underneath the gown and glove because most of the time when it's time to drape the patient, my doctor has already entered the room. Not always. There's going to be times where you drape yourself. However, in that event, I simply will take out the drape from underneath and that will be that. Otherwise, I like to have this pile in order. So again, top right, I have my doctor's gown, glove, drape, and we also, after we drape, before we put on the patient drape, we square off. And basically what this means is if we're doing an incision on the back of a patient, and the incision is this big, we're going to create a square with sterile towels around that incision, and then we're going to drape, so that way we only have a small area to work with. We want to minimize the skin exposure, etc. of the patient. So what I'm going to do is I'm going to grab 4 towels. That first towel that I grab, okay, the fold is going to be toward me because this will be the last towel that I hand off. The first towel, the cuff is toward me. The next 3 will be away from me, okay? And you can do this stuff to speed up the process because believe it or not, once you do get in that room and start setting up, you typically have about 30 minutes before the patient has now entered the room and we're about 10 minutes away from starting the case. Every second counts in this field and I want to integrate that into these videos, okay? So I have these set up. I know that I have so I'm going to do my drape last. My 4 towels are going to go prior to that. Gown, gloves, towel. Okay, so now this section is set up. Okay, we're going to leave the top right alone. I have quite a few things here. Now what I'm going to do is start to see what I have in my basin. So I have my medicine cup, which I always put at the corner or the edge of my table. So when the nurse comes, who is a non-sterile team member, he or she does not need to reach over my sterile field. They simply pour the medication on the edge. Then I will grab my medicine cup. I will label it immediately after verifying. And that's that. I have my light handles in here. So I'm going to take these out. Actually, you have the choice to keep them in your basin. And I think a lot of people prefer that. So that's totally fine. Okay. I have some syringes, some labels, my Bovie. Okay, so we're going to go over here. I'm going to put this suction into here as well. Now the reason we keep this into our basin is because when we get up to our sterile field, this is all going to get thrown off. We're going to hand one end of our suction to the circulator, etc. This will all be shown in a different part of the video. I just want to let you guys know why we leave it in here. It's not going to stay on our back table. This is all going to get thrown off. It's going to be handed and connected properly. You'll have one sterile end. Circulator will have the non-sterile end after they have touched it. Okay, they have to connect it to some machine, etc. Okay, so I'm going to open this. I have a needle nest. I'm going to open this. It has little stickies. You can take them off. And I like to place this at the bottom left of my table. Okay, so we're going to place that there. I have my Bovie as well, which you can also put on your basin if you like. It's up to you. I preferably like to keep it on my Mayo stand. However, that is totally up to you. Now, the reason I like to put it on my Mayo stand, I will talk about later, but I just want to put it out there. I like to put it on my Mayo stand. So in this bag, we have a few items. One of the items is our hypos. This is called a hypodermic needle, and what this is used for is after we get our medication on the field, we've confirmed with the circulator what it is, we've labeled it. We then take our syringe. Okay, I'm going to draw out my medication. I'm going to label the syringe that I've now put the medication in as well. And I'm going to put my hypodermic needle on the syringe. This is now for the doctor when he would like his lidocaine or medication of whatever I was given. Okay, so this is where the hypodermic needles come in. I also want to check for expiration date. So I want to make sure I confirm the name of the medication and the expiration date of the medication as well. Okay, so I have quite a few syringes. This can be used for several things. After I get my saline on the field and I've labeled it, I can have a flesh needle with some saline in it as well. Again, if I pull this up, I'm going to label this saline as well. You can also have 2 syringes with lidocaine or medication in it. So that's good to always have a couple syringes. I definitely don't ever have just one. Now here we have a 60 ml syringe. So this is a bigger syringe. It can be used for quite a few things. Actually, one would also be saline or sterile water. If the doctor would like to flush an area or clean an area, I'm going to suction this up, label, and hand this off to doctor. Okay. So it's nice to have various sizes of syringes on your field. Now this comes with disposable light handles as well. You can see that there's 2 different kinds because these are disposable as well. They're just harder. They're not as difficult to work with. However, they both do the same job. Okay. In this pack, I also get some suture. This is also another word for H-rose, okay? So I have my suture. I have fluoromonacryl in here, which is typically used on skin. So I'm going to keep my sharps and my softs in a designated area. Again, I also have a 5 ml syringe. So if the doctor wants a little less of medication or a little less of a fluid, this is perfect. 5 ml, it's not as big. Just remember, you always want to label everything that has been handed to you that is a fluid or medication of some sort. They all look the same. They all are typically a clear fluid. You have to label immediately so that there is no confusion. This is your field. You take control of it. I have another hypo. So at this point, I now have 2 hypos that I've been in contact with. Okay, here's 3. Okay, this is different. Okay, so I have 3 in total. I have a marking pen, which is how I actually am going to label everything that is handed off to me. So I'm going to keep this in clear sight. I'm going to keep my syringes together. I still have yet to get my medication, so I'll keep that on the edge. Okay, but I'm going to have everything ready so that when the circulator is ready for me, that there's no delay. I have my medication cup ready for her or him. I have my sharps in one area laid out. I have my softs in one area laid out. I also have any countable items ready for her to see. So we can both visualize, we can both agree on how many supplies of each I have. Okay, and we'll get into counting soon. But yes, we do have to count most of our items prior to the case, okay? I have a yank car suction here, which goes along with my suction tubing. I'm going to put that in my basin because that's all going to get thrown off the table. I have a Bovie tip with which we do count. We do in fact count our Bovie tips. Now typically they come on. So just this example, here's a Bovie. The Bovie tip is already on my Bovie, right? So they don't usually come alone. In this case they did. So you would just snap it on. Okay. Last but not least, other than, okay, I'm going to toss it. I have my little garbage bag here, you guys, so that's important. I have my labels, like I mentioned. We're going to keep those together. I have 2 blades, okay? This pack happened to come with a number 10 blade and a number 11 blade. Now, before you do anything, while you're setting up, I'm going to open these and let that blade show. Here's the reason why. If I have these, and you can see there's a little flap, you pull it open. If I have these out, not open, and my circulator asks for a count, and I say 1, 2 blades, that's not proper. There's been instances where there's been 2 blades in a packet. Now, then we've done our count, we've done our initial count, and we start the procedure, and I go to open it, and now there's 2 blades. We've completely done the count wrong. Okay, you have to follow the guidelines. The guidelines state you have to open everything, such as your suture. You can't just count and rely on the fact that this suture packet states there's 1 needle inside. I'm going to make sure, double check, and open that up and see for myself that there's 1 needle inside. And your circulator is going to want to see the same exact thing. Okay? So since I'm setting up, I'm going to open my blades. I'm going to set them near my needle holder because this is my sharp area. I'm going to do the same thing for the second blade. I'm going to do the same thing for my suture. So when it's time, there's no confusion. Everything is ready to go. Okay. Okay, I have my basin here. I'm actually going to set this over here. I have my asepto bulb syringe, which is where I'll pull up my fluid. It may be saline, etc. I'll label all that as well. I think I'm ready for my instrument tray now. So what I'm going to do is come over here. Now the inside of this instrument tray is sterile, okay? The inside only. Now if you come take a look with me, you can see that there's two handles, okay? I'm going to grab just the inside. If at any point I were to touch the outside, I've now contaminated, okay? We want to avoid contamination. That is not the goal. I'm going to grab the handles, I'm going to grab the tray, and I'm going to step away. Now you see I don't have this tray next to me, all on me, because before I proceed, I need my circulator or myself to double check that there's no fluids at the bottom of the tray, that we have not seen anything that may have contaminated this tray. Once I confirm, then I can take this and put it on my back table. Now, let's say I were to grab this and I put it on me. Circulator checks, she sees fluids. Now I've contaminated my entire gown and my gloves. So what I'm going to do is check. Also, if she were to check but I properly held it, all I'd have to do is change my gloves. So keeping this in mind, we have to follow the proper steps. Once I've got confirmation, I'm going to put this on my back table in the center. What I'm going to do is I first see a count sheet. What I'm going to do is hand this off to my circulator, okay? So again, I see a count sheet in my instrument tray. I'm going to pass it off to my circulator. They're going to grab one end without touching me. And what I like to do first is grab my stringer and place it on my towel roll. Okay, that's the first thing that I like to do. And what we are training here. You're going to put your instruments on your towel roll, prop them up nicely so you can see all of the instruments. And then what I like to do is organize in here. I want to get ready for the count. I want the circulator and my job to be less stressful, for us to be on the same page, and I want it to be very obvious as to where each instrument is while doing the count. So once you perform the count, you can look at your count sheet prior. However, your circulator or whomever's doing the count with you, typically the circulator, he or she will call out an instrument. You will give them the number of instruments you have, and they have the correct number. So if for some reason one of our numbers are off, then we would proceed and take proper action. However, they will name an instrument, and you want to have the instruments laid out to where we can both see them and it's obvious where they are and how many I have on my field. I also like to place my forceps in certain areas. So most of our forceps we have are either smooth or have teeth. So what I do is I place my forceps with teeth on one side and my forceps that are smooth on the other. I also like to do, for example, I have an Adson with teeth and an Adson without. So I like to place them near each other because I can assume that the Adsons with and without teeth are going to be close by on the count sheet. So again, just properly placing all the instruments on the inside at all times. You want this to be organized. Not at all during a case do you want this to be unorganized, because if during the case your doctor wants an Army Navy and you've left it in here but it's scattered, you're now wasting time. So always staying on top is a big deal in this field, okay? We want to stay ready for whatever we may need to do next, which is why we also have a proper setup and we have a standard setup, okay? Now, I think we're going to end today. We have 4 more portions of this. In the next video, you will see me set up this Mayo stand. You will see us perform a proper count with the circulator, and we will even get to draping the patient. So thank you so much for being here with us today. We look forward to the next few parts. If you have any questions or concerns, please reach out to Altamont Healthcare. We'll put the information in a link below. Thank you so much.